Okay, so we are live here. This is the third FB Facebook Live event. And so welcome, everyone. Um, so just a little bit again about what I've been doing so far. Um, the Facebook group is growing, so thank you, everyone. Thanks to all the new members who have joined the group. And in my hope, I really hope you're all getting something out of all the discussions and the posts that I've been putting up on this Facebook group. And there's been a lot of interest in the online practice interviews lately. I think it's because of the interviews that are coming up. So please go to my website, ed4medus.com, and you can sign up for an online practice interview. And the way it works is, there's about like a 25 to 30-minute um, interaction between me and the applicant, and that's recorded. And after that, me, the interviewer, and the applicant, we kind of discuss how the interview went, what are the areas of improvement, and kind of see how uh, I can help you guys improve your interview performance so that you're more confident and do your very best on the interview day. And so I've been putting some posts. The last few posts were about what do program directors look for in an applicant. And you must have seen the USMLE scores, the data that's out there from a survey that was done by NRMP. And what happened is, it also talked a little bit about, what do program directors think about research. And I was hoping to see a little bit more interest in research experience, but it seems maybe only, I think, about 40% of the program directors felt that it was important. But I still feel that, if the applicant is an international medical graduate, you just need to kind of make sure they don't have any excuse to rank you low. So I would still, if it's an international medical graduate, encourage them, that person, to obtain research experience. And I talked a little bit about it at my last FB Live event. And then there were also some discussions on the letters of recommendation, which of course, are very important. And I think one fact that was very interesting in that NRMP survey of the program directors was that if the program director knew the applicant personally, or through or maybe through another faculty member, that really goes a long way of getting the interview call and possibly even being ranked high. So the conclusion is that yes, while scores are important, scores more than 240 are important, step 1, step 2, and in the first attempt, do try to also obtain research experience, and please use all possible networking skills that you have through friends, family members, your graduates from your medical school, so that you can do your very best in getting as many offers as you can. Okay, so I'm going to move on to one of the topics that was that someone wrote and requested that I discuss. And this is a common question that is asked on the interview, is about strengths and weaknesses. And okay, so we have a question here. Is LOR from private clinic matter or not much? So when a faculty member, the committee who is looking at the letter of recommendation, gets a letter of recommendation, they first see, who wrote it and what institute that person is from before they actually go into the content. And so, yes, if the letter comes from someone from an academic medical center, um, I really think that does carry a little bit more weightage than getting a letter of recommendation from a private clinic, from someone, from a physician from a private clinic. The reason being, so if it's an academic faculty member writing the letter, um, they have worked with other residents and students, and so they are a better judge of the performance of you when you're kind of doing a rotation or an observership. And the letters that are and an academic faculty member has written many letters, just like I, so we know what terms to use in writing a letter of recommendation. So things like this person's performance was good, that doesn't mean, that's kind of not a very good, a very strong letter of recommendation. So letters from academic faculty members are much stronger, and especially if you perform very well during that rotation. But if you're not able to get into an academic medical center, if all that you have are maybe observerships in private clinics, I would still go for it. I don't see any harm in getting those letters. There are still some physicians who work in private clinic and have affiliations with an academic medical center. So you still could get some private practitioners to write a letter using their academic letterhead, and that I think would be a very nice a very nice letter to have in your portfolio. Okay, so yes, it matters, though if you look at the hierarchy, a letter from an academic medical center has more weightage. So hope that answers your question. And that answers your question. Okay, so weaknesses. Tell me about your strengths and weaknesses. I'm writing a blog right now and it should be out, I think, in the next half hour or so. And I'm going to start with weaknesses. Tell me about your weaknesses. Now, when an interviewer is asking you that question, you have to realize it's uncomfortable for them also to ask that, unless they've done like thousands of interviews. But it always is uncomfortable putting the applicant, and asking them to talk about their weaknesses. So sometimes, they kind of don't ask that directly. They will say things like, tell me about any your areas of improvement, or are there certain areas that you feel you can do better at, um, or have you made any changes in how you approach your work? So it's all, again, asking about weaknesses, but in a different way. So I think if you prepare yourself by being able to answer, tell me your weaknesses, you should be able to identify when the interviewer is asking you for your weaknesses and talking, and so that you can give an answer confidently. The post that I'll be putting on my FB group, that has actual examples, so word for word, some of the weaknesses that were disclosed to me by other applicants in these online practice interviews that I told you about. That gets all that's all going to be available for you to look actually at how weaknesses can be described. I'll focus more on what are the common weaknesses that you can reveal in during the residency interview, and also talk a little bit about what weaknesses, even if you think it's a weakness, I really don't think you should say that in your interview. So a very common weakness that's described is that I'm too much, that I really like to do things perfectly, and I pay a lot of attention to detail, and so that sometimes leaves me more stressed, and I have a difficult time also delegating work to another person. So you can say that because, in a way, when you're practicing medicine, you want to be perfect in your work, but you can't really be so much involved that you lose track of time, and your other work is getting delayed. So you would say things like, I have a tough time. In the past, I used to have a difficult time delegating work to another person because I would feel that I could do a better job. But then, because I have I've kind of noted that it leaves me burned out and stressed. I'm now doing a better job delegating work, and the way I do that is I give much clearer instructions to the other person as to what kind of work uh, I'm expecting them to do, and also I kind of give them the rationale for that work. So, for example, when I was, when I've been rounding here in the hospital, there was a patient that I really needed the nurse to do a bladder scan. So this was a patient who had acute kidney injury, was making very little urine, and who had a Foley catheter. And one of the things that commonly happens is that the Foley catheter is obstructed, maybe from some debris or the way it's located. You'll hear all that when you start your internal medicine residency, at least. And so um, the nurse had, the nurse was, busy and everything. It's an ICU setting. So the way I phrased my request was that, I really, I was really hoping if you can do the bladder scan, because I'm very concerned about why this patient is not making any urine. And so the bladder scan will really help me make a decision about whether I need to do a dialysis on this patient today. So could you please help us out by doing the bladder scan? So this way, instead of saying, hey, nurse, I need a bladder scan right now, instead of making requests like that, if you're delegating work or making requests um, in a much more professional way, in a much more clearer, giving clearer instructions, or and explaining why something needs to be done, it almost always gets done. And so this patient, we did find that the balloon of the Foley catheter was wrongly placed, and it was obstructing the flow of urine from the bladder. And so that had to be reinserted. Of course, the patient even needed dialysis, but it was not because of a faulty Foley catheter. So you can always say that delegating work, and it's a very common weakness. But I think, so what you're supposed to do is, whenever you talk about a weakness, you should explain the weakness, and kind of explain why this weakness bothers you, and then you're supposed to turn this weakness into a strength. That is, what have you done to fix that weakness? Because you can't go into a residency with this weakness that, hey, I have difficulty delegating work to someone else. Other things, are other weaknesses are that I try to do work very perfectly, and then I sometimes lose track of time, or I just get so much involved in the work that that I end up spending more time than I should. So this commonly happens, for example, in the research world. So, for example, if I'm writing a paper and I have to do a literature search, if you go to PubMed, there are thousands and thousands of papers out there. So the way I would phrase this weakness of mine is, if I have, is that I do have, I do like to pay attention to the details, and do like to do my work perfectly. In the past, when I used to do my research and literature search while writing a manuscript, I ended up finding, 30 or 40 references, printing everything out, and then only starting to write something in the manuscript. But that just caused me to be more overwhelmed with work and more stressed with work, and that kind of uh, caused me to not make much progress in my research writing. So what I've done lately is that when I do a literature search, I just identify. I do find the 40 citations that I need to review, but I pick and choose just 5 papers that I absolutely need to read about. I read those papers, get a very good idea about how I'm supposed to write a paragraph. I then start writing the paragraph, and then I go through the other references to add or remove certain citations or matter. This way, I kind of still I'm doing my work perfectly, but I'm not overspending time and effort and being stressed out about it. So trying to do work perfectly is sometimes also a weakness, but you have to explain how what kind of strategy you have to overcome that weakness. Now, other weaknesses are commonly described are I have difficulty in saying no. That is, if someone asks me to do a certain work or to cover for another colleague, or covering a clinic for another person, I often say I have a tough time saying no. And So the way you would frame that as a weakness is that I do have a weakness that I find it difficult at times to say no, and this has caused me quite a bit to take on more work than what I can handle, and this also steals away precious time that I wish to have with my family, even though my family is very supportive. And so what I've done more lately is I'm doing a better job understanding these requests and trying to identify which ones are a priority. And if it's something that another person might be able to do, um, or if I just have too much work or family responsibilities on my plate, then I politely decline to say no. And I do give a reason as to why I say no, um, just so that I can also tell the other person that I sincerely considered their request, but but it was just a bad timing. Having said that, if a colleague of mine needs me to cover their call for a family emergency or an illness, and if it's an urgent thing, then I'm very happy to help. But requests, for example, to write a research paper that would not be very contribute a lot to my research or to my career, I've now decided to say politely decline their offer. So difficulty saying no is another a common weakness, and the good thing is that you have to learn how to say no at certain times. You can't just say yes to everything, and um, and kind of really give up your life. So so that's another weakness. The, a common another weakness which I've described in my blog is being an introvert. So that's again a very common personality type, being an introvert and not really having a lot of uh, uh, social interactions with other colleagues. Now the thing is, you have to understand that in the US, it's very interesting. I attended a class called MBTI where they talk about these different personality types, and um, the speaker was saying about how the US culture, the work culture, is extrovert. That is, they get more energy by interacting with people. And he did say that introverts sometimes silently do suffer. But I believe lately people have realized that some of us are introverts, and that it's okay. And so if that's how your personality is, then I would say, hey, I've been told by my family and friends that I'm an introvert, and in the past I felt that this was a weakness, but I've realized more and more that I can that while I don't avoid social interactions, I've tried to take up some topics or some areas of interest that are commonly discussed here in the U.S. For example, in the blog I wrote about sports or and that kind of a thing, and this has allowed me uh, to still be an introvert and focus my thinking in areas that really need a lot of thought processing. But at the same time, I feel more comfortable now in having social interactions. You don't need to like change your personality type completely from introvert to extrovert, but at least you need to show some. So if you're an introvert, you need to at least try to show to them that you're not just cutting off from all the social interactions, because networking is a very important skill. Okay, there's another question here from Shams Ghanim. Is research from my home country matters? Um, so my answer is, and you must have seen one of my posts about this research. So this was research done in one of the villages in India, where so that was done in that applicant's home country. So I think it's okay. I mean, research is research wherever it is done. It all depends on the methodology, whether you asked a good, scientifically valid question, and you employed a very nice and scientific method to answer that question, what your results were, how you're presenting the data, maybe where it got published. So if if the study was done in another country outside US and got published in a good journal, yes, by all means present that. So no, I would not consider research done outside the US to be inferior. But again, it depends on how that study was done, under what setting, and whether it is scientifically valid. I think if it's scientifically valid, and you have the data to present, by all means, it does matter. So and I think that's very good, important. That's very important, and nice to have on your CV. Was my research was about MDR. Okay, good, very nice. MDR, I'm thinking, is multi-drug resistant bacteria. I would think that's what you're talking about. So great. Then by all means talk about it. I don't see why that's going to be a problem at all. How many years after graduation affect my residence chances? I mean, it's quite clear that the longer you're away from graduation, your chances do get more and more difficult. Um, and I think it's because program directors feel that how is this person going to go back into the clinical medicine after being so many years out of med school. Um, and you may have been you may have done like medical school and even done residency in your home country, or I don't know, or a PhD or something. There's always a little bit more hesitation for a program director to take someone who is maybe like 7, 8, 10 years out of medical school. Have I seen people who have been that long after medical school get a residency position? Absolutely. There are people who do go into internal medicine, family medicine. Uh, yeah, maybe it's more difficult to get more of the competitive specialties. And for example, there are some who did like orthopedic surgery at their home country, but when they moved to the U.S., or ophthalmology in their home country, but now when they move to the U.S., It's just because it's more competitive and they have those years of graduation, of being maybe an international medical graduate. It just becomes more and more tough for them. So then you have to like start, using more of your networking skills, maybe your research experience to try and get into, I'm going to use the word, a smaller program. Now, I do want to say that even getting into a program that may not be as desirable as others, as long as it's ACGME certified. ACGME does a very good job and is very strict about the quality of residency education, and they do a very because every year they do send out a survey asking all residents about what's happening in their program. And so as long as it's ACGME certified, I think that's all fine. And then once you come out, it all depends on you and your personality and how much hard work you're doing to become successful, especially in the clinical practice side. So, do you mind sharing how many years? Let me write that down. How many years after? How many? How how long has it been since graduation? Since graduation for you. And were you doing any clinical practice in the interim? Okay. All right. So I'll continue my talk about the weaknesses because we're kind of getting close to the half-hour mark. And there are some weaknesses that I really, really don't think you should say, even though if you feel that's a weakness. One of it is I think some of international medical graduates feel that just because they're coming from a different country, their English is not perfect. But I'm going to say if you've taken the steps and CS and you've gotten to the point of residency interview, your English is perfect. So maybe the accent might be a little bit different, but that's fine. So I would say almost never say that English is my weakness. That's going to be bad. So almost never say that as a weakness. Another weakness that I really do not think you should say is procrastination. That is, even though if it's even though it's a weakness, and you might give some examples on how you have fixed it. Once you're a procrastinator, you're always a procrastinator, and I really think you shouldn't say that as a weakness. Difficulty asking for help. Now that's another thing which I really don't think you should say as a weakness. So I don't really think you should say, hey, one of my weaknesses is I don't ask for help. That's almost considered, that it's not it's not considered very favorable for a resident, for someone going into residency training and not asking for help. So that should never be disclosed as a weakness, even though if you feel you might have it, have that issue. What I'm going to do next is, since we're almost running out of time, I will be posting the actual weaknesses on my blog. There'll be like 4 blogs that will come out. One is the actual weaknesses, what you can say. The second will be weaknesses that you should not say. Then will be strengths. We didn't get into strengths today, but strengths I think is much more easy to say. Things like I'm a good team player. I'm a good maybe I'm a good leader if you have good leadership skills. I'm a hard worker. Those kind of things. And then some strengths that you should not say. So things like, I'm a perfectionist. Things never go wrong with me. That's kind of, that shouldn't be an attitude of a resident. So, so there are some strengths that you should not say or you should maybe rephrase it in a different way, but don't say one of my strengths is that I'm a perfectionist. You're just being very proud of yourself that way. Okay, so we're running out. We're done with the 30 minutes. And so let's see, there's something that says, one of the comments, I was graduated 2 years ago. I was general physician. I think it's perfectly fine. 2 years is not much. And some might even consider that as a, that, hey, you tried to apply some of the knowledge that you gained during med school in clinical practice. I think that's all perfectly fine. 2 years is not bad, not bad at all. Especially, so you also have to like think about scores, letters, dean's letter, and whatever research experience you have. So but in your situation, if you just graduated, if 2 years ago, that should not count against you being considered by a program. So yeah, 2 years is kind of nothing really. Okay, I hope that was all useful, and some more blogs and posts to come out for everyone. I hope giving these actual examples is helping you out. That's how I think my blog and my group is different from others, is because I like to give the actual examples rather than just give the theory and then have you all sort it out. So be on the lookout for it, and I hope to have another FB Live event in the next few days. Send your questions, or if you want me to have another FB Live, Facebook Live event with your questions, let me know. And all the very best, and see you all soon. Take care now.